Hi everyone. Yeah, thank you very much for having me today. Can I just check that everyone can see my slides? Okay, get a little thumbs up.
Yes, we can.
Awesome. Thank you very much. Thank you very much for the warm introduction and kind of having me here today. And massive thank you to Tom and Don for organising today's session. Appreciate it. It would have been lovely to be in Italy with a glass of wine and a cup of coffee or whatever it may be, chatting with you all. But this is going to have to do as a good second option, but it's massive thank you for organising it like this. So I'm going to provide an update today on the role of and the prevalence of exercise testing and training here in the UK. And so that's quite a nervous little thing because all my co-authors are on the call with me right here, right now as well, actually. So Zoe, Dan, Don and Craig have all helped contribute towards this survey that I'm going to present. So I think amongst us all, we fairly well understand the purpose, the rationale and the desire for exercise testing as a routine measure in cystic fibrosis care. We know it's got these strong associations with mortality risk, transplantation risk, quality of life and so forth. And so obviously we have our own ECFS statement advocating for regular exercise testing. The recent physiotherapy guidelines via the CF Trust advocate for annual exercise testing. And here in the UK, NICE, the National Institute for Health and Care Excellence, who help create and kind of govern some of our clinical practice guidelines, they've also advocated for regular exercise testing in their first CF management guidelines that they've produced. So there is certainly a desire, a want, and a need to have it implemented into routine practice. And so whilst we've understood this for a while, it's taken a little while for maybe the rest of the community to catch up. And so this was originally surveyed back in 2010. So Dan and Craig, along with one of our consultants down at Exeter and another one of our professors, implemented a national survey here in the UK looking at the prevalence of testing and training in CF clinics. And fundamentally, they found, as we can see from this bar plot, that there's a really strong level of importance applied to testing and training. Clinicians, physiotherapists, nurses overwhelmingly did say, you know, we perceive exercise testing and training to be important in CF care. However, some of the numbers didn't quite tell the same story, despite it being valued as important and advocated for. Only around half the centres surveyed actually utilised some form of exercise testing. And of these, only around 35% were done on an annual basis as part of that annual review process. The majority of these tests were shuttle walks, the incremental shuttle walk test, 15 level, with also 6-minute walk step tests and a small number of centres using CPET. The major barriers to implementing testing and training were personnel and time, and then also a facility and equipment issue as well. And then with regards to exercise training, this kind of ongoing management of exercise within CF care, a little over 80% of centres discussed exercise with patients as part of their programme of care, with around, again, 80% doing so at every single face-to-face appointment, which is quite an encouraging statistic, but still there's around 20% that weren't. So this is what the landscape was back in 2010. However, a lot has changed since 2010. Some things have been a bit interesting, shall we say. Some things have been unfathomable. Craig has yet to provide me an answer of why and how Liverpool won the Premier League. But in CF care, you know, the landscape really has changed. We have our modulators have come online. The last 10 years has been a phenomenal change. And then equally, these drugs being approved. We're here in the UK, we have these new NICE guidelines for how we manage CF. And equally, if we talk about exercise and CF, the volume of literature that's been published over the past 10 years has massively increased. So in the last 10, 11 years, you know, you kind of have nearly over 750 articles have been indexed on PubMed. This is more than the previous 45 years combined. So there's been this massive increase in interest in the role of exercise in CF over the last decade. Add on top to that, we have this desire, kind of this PPI input from the James Lind Alliance. You know, there's a focus we've already discussed on, can exercise be used as an alternate to chest physiotherapy? So there's a patient-driven desire to see more focus on exercise in CF. And then equally, us as a community, all of us on this call have kind of helped contribute to some of the bigger pieces of evidence over the past couple of years. And I just highlight, for example, the paper in the Blue Journal a couple of years ago, kind of re-emphasizing the association between fitness and mortality and transplant risk, and the recent reviews in the Cochrane Library as well, looking at exercise training and CF, all happening in the last 10 years, highlighting kind of the shifting landscape in how we look at exercise as part of CF management. So there's been a real push and in fact fundamentally a need to reevaluate how and why exercise services are being implemented here in the UK, and see kind of where we go from here. So what we have done is we've distributed an electronic survey distributed by Qualtrics as an online platform, and this was generated over the Christmas break, and then we sent it out in January. And we have distributed this via the ACPCF, the CF and Exercise Network, and also the UK CF Medical Association as well, via email. And we've explicitly asked for one response per centre here in the UK. So we're having that centre-wide approach, and we're not going to end up with any kind of bias of having multiple people per centre answering the same questions to muddy those waters and create an incoherent response. So we've got a really robust way of implementing this. We had a little over 60 questions, including a mix of multiple choice, fixed responses, kind of your classic yes, no's, and then a series of open qualitative responses as well. And we asked a series of questions looking at centre details, just fundamentally, where are they? What kind of centre are they? And then looking at prevalence of testing training. And then we also sought a brief update on how the pandemic had affected practice at the same time. So we left the survey open for 6 weeks, and we've collated the responses that we have received. So we had 31 centres respond. And when we consider here in the UK, we have 55 specialist CF centres scattered across the country. This represents a little over 50% of those specialist centres that have responded. So this is a similar response rate to the original survey Dan implemented back in 2010. We can see a majority were paediatrics focused, but we did have a mix of mixed centres and adult centres, and with the majority of our respondents being physiotherapists. We did ask, as part of the response profile, for it to be the main person responsible for exercise provision in the centre. Hence, we're seeing a larger number of physios complete this, which is great, absolutely perfect, this is what we wanted. So kind of the highlight reel, I guess, in what did we find? What has changed in the past 10 years? And so if we look at 2010, I've previously shown some of this data. We saw a little over 50% of respondent centres were using exercise testing. This has gone up to 94% were using exercise testing as part of their routine management of CF, which is fantastic to see. And nearly 90% were doing so at annual review. A lot of centres were also using exercise testing in response to changing patient status. So if somebody's suddenly reporting shortness of breath and exertion, or they've started a new training regimen, they were also implementing exercise tests around these reasons as well. There was a subtle shift in kind of the field tests used. There's a massive drop in the number of centres using 6-minute walks, so I'd almost, and shuttle tests. I'd almost call this a good drop in the number of tests being used, because if we look at the next line of data, there's effectively a doubling in the number of centres using CPET. So 48%, nearly 50% of centres were using CPET. And we all know that this is the gold standard we're really wanting to push for part of routine practice. And it's really encouraging to see that this change was happening and so many centres were utilising it. I guess a negative increase or a bad increase to have seen was that there was a greater restriction on space and time, being the main barriers towards implementing testing and training in these CF clinics. So whilst we've seen an increase in care, it's going to bring these new challenges to how we implement our day-to-day practice. So we're seeing these same pinch points occurring in clinical practice. Encouragingly, our statistic in terms of discussing exercise training had increased. 100% of centres that responded stated that they discuss exercise training with their patients. That's a fantastic response. There's no other way to look at it. This is absolutely brilliant. And 94% of them doing so at every clinic appointment. Otherwise, they're being discussed at annual reviews and so forth. We saw that physiotherapists were and still are the main kind of go-to individual for the provision of exercise services. However, we are seeing an increase in the prevalence of support staff. So whether these are exercise therapists, exercise technicians, each centre kind of labels them slightly differently. We've seen an increase from 0 to about a fifth of the workforce being these exercise technicians, exercise therapists, the support staff whose sole focus is on exercise in CF management. And that's, again, a really encouraging change to see as part of our clinical practice. So moving on, we also, as I say, briefly sought kind of the feedback on how the pandemic had affected practice as well. And we can see briefly that nearly every single centre stated that exercise testing, had been negatively affected. And around 70% of centres stated that exercise training, so their ability to deliver training and exercise prescription, had been negatively affected as well. So the bottom figure there is just showing how often centres were able to implement testing and training. So the majority weren't able to implement anything. However, despite this, a really large number of centres had shown a phenomenal capacity to adapt and overcome these barriers and this massive challenge we've been faced with. And around 70% of centres were stating that they'd implemented some form of telehealth exercise. So Lisa's just kind of given us a great talk on how they're implementing and using Beam in their centre. A lot of other centres are taking a similar approach in terms of e-health, video classes, online delivery. And they found it to be so useful that they intend to keep these going forward after the pandemic as well, to implement that as part of our routine practice moving forward. So it's encouraging to see that whilst we've been presented with this challenge, we're overcoming it and adapting as we move forward. And so kind of as a brief discussion point as well, why are we seeing some of these changes? We can't be wholly certain as to why some of these changes are occurring. Fundamentally, it's on a centre level basis why some centres will go from not using testing to using testing, is that they've had increases in funding or capacity or staffing. But part of that staffing question is something that we've been looking at over the past couple of years, and we're seeing this increasing prevalence in the role of exercise support staff as part of the CF MDT. And this is a piece that James and I certainly have been working on thoroughly over the past couple of years, and now we're partnering out with Lisa from the ACPCF to implement this role further. And we see these individuals, they typically come from a sports science background, and they'll have full training in sport and exercise physiology, exercise training, strength and conditioning, and they can really implement inpatient, outpatient training very well, implement testing as well. And it's a unique kind of role that we could have as part of the workforce. And I wonder how much of this may be responsible for this changing landscape. And interestingly, it'd also be great to see where this role moves in the future as well, as part of our shifting change in CF care. So to summarise, we're seeing some really positive changes in the landscape for exercise testing and training in UK CF clinics, with the overwhelming majority of centres undertaking testing and training. We're seeing this massive widespread adaptation to the current pandemic too. However, we do have to kind of acknowledge some of the limitations to our study design. Due to the anonymous nature of the survey, we can't guarantee that every centre that was surveyed last time completed the survey this time. This is the downside to anonymous surveys. There's also a potential for a responder bias. If you are a centre that has got a real keen interest and focus in exercise testing and training, are you more likely to respond to a survey that asks about testing and training? And we can't conclusively say why some of these changes have occurred. But fundamentally, let's be grateful that they have, So I think this is a fantastic change to have seen. So I'll end my talk there and happily invite any questions. Just a massive thanks briefly to Caroline Elston, Tom Kent, Lisa Morrison, Joe Shelley, helped us distribute the survey, Tom and Don for organising a fantastic meeting, and just to acknowledge the CF Trust for helping funding our work as well. Thank you very much.